I sort of have a foot in two different worlds. So part of what I do is neuroethics, which for me involves a lot of writing, a lot of organizing projects, writing grants, writing papers, mentoring students, giving talks. And the other part of my life is as a practicing neurologist. So seeing patients in an outpatient setting and then inpatient as well. So I sort of split my time between those two things on a day-to-day basis. So to the latter question, I mean, I think that's an open question whether or not it can keep up with advances in technology. I think it can certainly try, and I think that's sort of the one of the most important things for bioethics and neuroethics to do is to try to keep up with the really rapid developments in technology that are affecting particularly healthcare around the brain, and then outside the brain or areas of the brain. And so how is it growing as a field? So, I think sort of interest in ethics and the brain, 20 years ago tended to be focused on neurologic diseases and problems that arose from neurologic diseases in issues that arose in the hospital. And then really it was sort of in the late 90s, early 2000s when the technology to do a lot more in studying the brain, both imaging technology, MRIs, functional MRIs, and sort of electrodes, being able to measure different activities in the brain, they really took off. And so it's really been in the last 25 years or so that neuroethics has become more relevant and bigger, just because the neurotechnology has just exploded during that time. A lot of the BCI technology development is being done for medical indications. So for people who have motor disabilities, communication impairments, psychiatric illness. And so right now, the devices are being built for those populations. And so it's important to talk to people in those groups about what they want or don't want, or what concerns them or what doesn't concern them. I think as technologies are being developed that target non-medical uses, so a transcranial stimulation device that purports to improve concentration or those sorts of things. If devices are being built for people without disabilities, I guess one of the important questions is is the knowledge that's going to be gained by doing research with people with disabilities now, will that technology translate into devices that will help them in the future, or will that knowledge be used to help people without those disabilities? And so I think one of the important things as this research goes on is to keep in mind who's going to benefit from the technologies. And so if funding is being given to projects, that researchers really should be able to elucidate how that technology, if it's successful, is going to benefit the people from the groups who are participating in that research. So I think that a lot of the research that I do in neuroethics involves talking to what are called stakeholders, right? People who might benefit from technology, and a lot of those stakeholders have different kinds of or struggle with different kinds of neurologic diseases. And so just my experience with treating people with different kinds of neurologic conditions helps me understand the things that they deal with on a daily basis. And so I can kind of maybe better know how to interview people because of that. On the flip side, I think thinking about the ethical implications of technologies, when I then interact with patients, I think it helps me. I think better understand where patients are coming from and what their expectations are of diagnosis and therapy, and to be realistic with patients and families about the benefits and harms of different therapies. So I think it's helpful. Both lenses are helpful in both directions.